Hello, my name is Nick Harvey and I'm a Senior Lecturer and Honorary Consultant Rheumatologist at the Medical Research Council Life Course Epidemiology Unit at the University of Southampton. My research interest is around what we can do early in life to optimise bone development and to reduce the risk of broken bones in older age. I'm really grateful to all those who are already part of UK Biobank and have contributed data relating to bone quality. This imaging enhancement offers a really exciting opportunity to study what factors determine the size, strength and density of a person's bones and how these factors might predict risk of future fracture. Osteoporosis literally means porous bones and refers to the situation whereby there is a loss of both bone tissue and its structural integrity. This leads to an increased risk of fragility fracture, that is, a broken bone resulting from a low trauma event such as falling over. Such fractures cost the UK economy around £3 billion per year, much of this resulting from hospital treatment for hip fracture. Major fractures resulting from bone fragility are associated with reduced lifespan, bringing survival down by around 20% compared with people who do not experience a fracture. Fragility fractures are extremely common. It has been estimated that after the age of 50 years, 1 in 2 women and 1 in 5 men will experience a major osteoporotic fracture in their remaining lifetimes. So osteoporosis is clearly a significant public health issue. Although we now have very effective treatments which can reduce fracture risk by around 50%, the scale of the problem means that we desperately need to improve our understanding of what factors determine fracture risk and how bone density and quality might relate to other diseases. UK Biobank is unique in many ways, not least in its scale and its assessment of multiple organ systems relevant to a comprehensive range of diseases of middle and older age. The really exciting thing about this imaging enhancement is that we will have the opportunity to study bone mass and determinants of osteoporosis in relation to other common chronic diseases such as diabetes, atherosclerosis, hypertension, dementia and sarcopenia, which is muscle loss. This is a unique research opportunity and promises to deliver groundbreaking scientific information. The DEXA scan itself is painless and involves a very low dose of X-rays, comparable to those which might be experienced from the background atmosphere over a few days in Cornwall. The scan will obtain images of your entire skeleton and more detailed images of the lower spine, hips and together with the knees. A further scan will assess the whole spine. These images will allow us to measure bone density at the lumbar spine and hip and also produce detailed images to assess early changes of osteoarthritis and changes in the shape of the backbones. Furthermore, the whole body scan allows us to measure the amount of bone, fat and muscle tissue in the body and can be related to the more detailed measures obtained from the MRI scans. As our population ages and the number of frail elderly increases, it will be essential to work out ways to help achieve healthy ageing. UK Biobank provides a unique opportunity to really understand the determinants and precursors of diseases of older age, and I'm really grateful to all of our participants thus far. It is fantastic to be involved in one of the most exciting scientific projects around in the world today.